In the case of a Latissimus dorsi flap, it uses skin and muscle from the back of the patient. The Latissimus dorsi flap is commonly combined with a tissue expander or implants to create volume for the reconstructed breast. When the LD muscle is being channeled to the front of the patient, it leaves behind a contour deformity due to the excess muscle being transferred to the front. The tissue expanders will then be used alongside the LD muscle to expand the volume of the breast to a suitable shape. The pedicle will then merge with the Latissimus dorsi LD muscle through a technique called microsurgery, after which the dissection will close up to form a scar. The areola can then be recreated through additional surgery procedures if the patient chooses to. A deep inferior epigastric perforator (DIEP) flap reconstructions involves using fats and skins from the patient's abdomen. Women will benefit from a tummy tuck whilst having their breast reconstructed at the same time. After its removal, the DIP flap will then be brought up to the dissected breast, leaving behind a scar. The patient will then benefit from a tummy tuck in the process due to the excess fat being taken away. The flap will then be reconnected to the breast via the blood vessels through microsurgery to ensure blood flow. Further surgery to recreate the areola is then made available as an option if the patient chooses to. A transverse upper gracilis TUG flap reconstructions uses tissue from the upper thigh as well as the gracilis muscle. Its action is to adduct the thigh. The gracilis is considered an expandable muscle. Its sacrifice does not result in any noticeable functional impairment. When removed, the TUG flap is then brought forward to the dissected breast. The inner thigh will then appear less flabby, and if the patient chooses to, liposuction can be performed on the other thigh to make it symmetrical. The TUG flap will be reconnected to the breast via the blood vessels through microsurgery to ensure blood flow. Further surgery to recreate the areola is then made if the patient chooses to.